I'm Jennifer, the medical administrator at T579, and this is the skills portion of my CPR instructor course for the American Red Cross. Okay, so now to teach CPR, we're going to set up a scene. We're rushing to a code. Someone brings the AED, somebody brings an ambu bag, maybe we're the one who brings it. We come onto the scene, we make sure that it's safe. We want to make sure that there isn't anything ready to fall or that the patient isn't falling or anything. So we make sure that the scene is safe. And we call for help. And we make sure that we're not alone because we never want to do CPR alone. Then I see Johnny laying here on the floor and I'm going to say, Johnny, are you okay? And I'm going to check for a carotid pulse. If I don't feel a pulse and he's not answering me and he's not breathing, we're going to start CPR. Now, if I didn't have my AED and I knew somebody was on the way to get it, or maybe we didn't have one at that particular moment, I would go directly into chest compressions and breaths in a 30-to-2 ratio as recommended by the American Red Cross. But since I have my AED, the first thing I'm going to do is open it and turn it on. I'm going to put on my gloves because we always want to protect ourselves. And as this is starting up, we're going to unfold the pads. Now these are trainer pads, and they have this lovely diagram for you. All of them will have diagrams here. Not all will have this attachment. But this one is kind of nice because it tells you where to do CPR once you have the pads situated. So I'm going to press the button and follow the prompts.
Stay calm. Check responsiveness. Call for help.
Which we already did. We've already called for help. And now we're ready to attach the pads. When we're attaching the pads, they're very, very sticky and they're going to stick to our gloves. But we're going to attach them just like it says on the diagram. Just the way it says it. And we've attached the pads. First thing it does once we've attached the pads or plugged them in is it tells us not to touch our patient because it's analyzing the heart rhythm. So right now, it's analyzing the heart rhythm. If we were touching that patient, it might pick up on our rhythm, even if we were just checking a pulse. So now it's telling us that there's a shock advice. The most important thing here to do is to make sure everyone is clear. Clear the patient. Say it as loud as you can. Clear the patient.
Don't touch patient.
Shocking.
Shock delivered.
The shock was delivered.
CPR.
Now, it will remind us to do CPR. As you heard, the AED will help you keep a cadence going. You can use the theme song or the popular song Staying Alive, or you can use Another One Bites the Dust. Both of them will keep the same cadence. When you're doing chest compressions, one hand down, you're going to put the other like this, and we're going to use the ball of our hand, the palm of our hand here, and we're going to go to the center of the chest, slightly down from the nipple, and we're going to depress the chest 2 inches. It's very important that our arms stay straight and our shoulders are on top of our wrists. We're going to go down and come back up. Down and come back up. It's very, very important to allow the chest to recoil because you're letting the heart fill back up with blood before you are manually pumping it back out. You're going to do that 30 times and you're going to do it counting out loud so that if it happens to be a second rescuer comes along, EMS come along, they know where you are in your sequence. And then you can give a detailed report to the rescuers that are on their way. So, after doing 30 chest compressions, then we're going to give 2 rescue breaths. A lot of people use these face shields, which are fine and dandy. They allow for a barrier. They protect against a lot of things. You can place them over someone's mouth. And then with the pinch method, with the nose pinch method, you're going to tilt back their head, pinch their nose closed, and you're going to deliver 2 breaths. You're going to put your whole entire mouth over their whole entire mouth while you are squeezing their nose shut and their chin is tilted back so that it opens their airway. And you're going to deliver 2 rescue breaths. Watching the chest rise. That's important. Another thing that you can do, if you don't have these fancy face shields, but you happen to have an ambu bag, then what you can do is you start at the bridge of the nose and go all the way down, start up and rotate down this way You can grab onto their chin with your hand, tilt back, and deliver breath that way. 2 breaths. And then you resume chest compressions.